No, no. So you won't shield it all for this one that we're about to go over. Can one of you guys hold this so that you guys get a better view when I upload the videos at home? Somebody, anybody that's not recording on their phone. Okay. All right, I need somebody to do my education. Asking people. Actually, yeah, this weather is making it very difficult to try to wake up. What I said, you guys already 40 inches. All right, so we'll go ahead and go over hip first. So you remember you're going to do pelvis for your hip series. So you find the top of your crest. On her, it's really easy. You can feel it right away. Point her feet in towards each other. She'll stop breathing, and then your CR is just right below your ASIS. So make sure you have all of symphysis pubis all the way up to the crest. And then you'll expose. Make sure that the cassette is also crosswise. You don't want to make sure it's clockwise, because then you'll cut it off. But you guys don't really have to worry about cassettes all that much anymore. But if you do these portable, make sure it's crosswise. So we'll do her left hip. So we'll go down to 12, 10. So your CR is going to be pretty much right where her femoral head or neck is. And then you'll have just below her crest. So cup of light pretty much at ASIS. That way you include all the way down to the lesser trochanter. Turn the foot in that we're looking at, just like you would on the pelvis. And then everything else is still lined up. So if you were in the bucky, you'd be fine. You swap out your cassettes. You guys don't have smaller cassettes anymore. And then make sure you have a little bit of light on the outside of your leg. And then all the way into symphysis pubis as well. So, all right, relax your leg. Now bend this leg out for me and then let it fall to the side. So for frog leg, same thing. You really don't have to move anything. You can literally just put her back in that position because it'll get all the way out to the lesser trochanter again. And then you don't have to move anything else. So that's going to be your hip series. Put your leg down. All right, so moving on to AP sacrum, which is 15 degrees phallic towards her head. I'm already in a 10 by 12. I always just find the top of the crest, make sure that we get sacrum, which will line you up right here, right about ASIS, and then make sure you have symphysis pubis. So if you have symphysis pubis, top of the light is at crest, you're going to get your sacrum, and then just make sure it's midline. You don't have to do anything with your feet. Move your cassette, make sure everything is lined up. And then you can just keep your cassette crosswise or lengthwise, since you guys don't have small cassettes, it won't be a big deal. So that's your AP sacrum. Your AP coccyx is 10 degrees caudad. Line up again. Then we'll go down to an 8 by 10. And 2 inches below ASIS. Just make sure you get your coccyx. So it's pretty straightforward and simple. You're going to roll onto your left side. 12, 10. All right. Check with your hands underneath your face like you're sleeping. Make sure she's completely straight. You always want to adjust their hips and their shoulders, because if one way is like that, it'll rotate everything right here. So you want to make sure everything is nice and straight, and you put your hand against the back of their lower back. It happens to people who've been doing this for a long time, so you run out of trouble sometimes. So find the top of her crest and push her forward, scoot your whole body forward a little bit. There you go. All right, so pretty much you're like, if you have a 10 by 12 set up right here, your light is going to cut her body pretty much in half. That way, your majority of your light is on the back side of her because your sacrum coccyx curves around the most posterior aspect of their body. You want to make sure you get everything and then make sure that your patient doesn't move on you. It's kind of hard to stay super flat on this table. Find the top of the crest. On her, it's super easy. Put your light there. And then your crosshairs pretty much come to the ASIS in the front. So that's your lateral sacrum coccyx. You only do one picture because you'll get the whole thing in one picture. And we didn't move the CR the entire time. It's all at 40 inches. Just make sure everything's still lined up. Okay. Oh, you always mark side down. So if you're doing, like everything for spine is going to be left side down. So you always mark left on this one. It's a good question. So if you do sacrum coccyx, lay back on your back for me real quick. For your sacrum, because you have an angle going up, so everything's shooting up, you want to put your marker for sacrum at the bottom. So your sacrum makes this like kind of like a pointed, like a diamond shape at the bottom. So if you put your marker down here, you're not going to be in anatomy. Versus the coccyx, you're going the opposite direction and put it at the top because it comes to a point too. So always be kind of mindful of where you're putting your marker. So if you're doing coccyx, put your marker at the top. If you're doing sacrum, put your marker at the bottom. And then on the lateral, as long as it's not in anatomy.
On the practical, are you going to be trying to use these like you're down to those specific like 8 by 10?
No, but I just expect you to call me without cutting off your anatomy. Yeah. So make sure that you still have your top of your light at your crest for your sacrum coccyx series, because if not, you're going to cut off your anatomy. So I won't be like, it just, so when I went to school, we had all the way down to an 8 by 10 cassette. So I'm used to like adjusting ahead of time. So I still do that in the hospital too. So, and then SI joints, I mean, I can show you guys, but it's not going to be on your practical if you want to see them. Okay. We're going to do 30. All right, scoot over to your left a little bit. So top of crest is where her light's going to be at. And then Nicole, if you can give me that like 45 like triangle sponge, yeah. All right, so that's your AP for your SI joints. It's going to make those SI joints like really stand out and be open. And then bring this hand over to your left shoulder, bend this knee up, and then roll a little bit onto your side. Don't scoot your hips or anything. All right, roll back. All right, stay right there. So go back to AP. Shoot side up. And then you come internally just a little bit. And then find your crest again. And then you want this leg pointing straight up. So that this SI joint is nice and open now. Correct. Yes, because left side is posterior side down. So left PO, so posterior side down.
And then you would mark that.
Right, because right side up. Yeah. That way there's no confusion. You would most or mark and either super internally over here or like way out here, because your SI joint is going to be right here. So just inside the ASIS is where your SI joint is at. So either way out on the outside or way on the inside. That way you don't have any discretion that it might end up in anatomy. So, all right. Roll onto your side just a little bit. Go back onto your back. All right, bend at this knee. Bring that hand over. And roll back a little bit. And then same thing over here. So pretty much your CR is going to run like right at your ASIS or right on the joint opening itself. And then pretty much to belly button in the middle. If that's like any kind of body landmarks for you guys. And then again, you want to make sure you find the top of the crest to make sure you have that whole SI joint in there and nothing else changes. So this would be left side open, right side down. Good. Okay. All right. Do you guys need me to review anything else? This is all that's going to be on your practical coming up.
So the AP hip, or you do the AP pelvis,
Mhm.
and then the head.
Mhm.
Are you gonna do both heads or just one?
Just one.
So you'll do the AP pelvis and then the hip, AP and the lateral,
Mhm.
and then we're gonna do sacrum and then coccyx.
So either whenever you guys pull for your comps, like since you guys are partnered up, one person's going to do the sacrum coccyx series, the other person's going to do the hip series. That's the only two choices on this practical.
Okay, so the sacrum's gonna be, the sacrum and coccyx are together, so you wouldn't. do
Yes.
one or the other.
No, it's like a whole series together. You'll always see it ordered that way too. It's always a sacrum coccyx series. So you do an AP sacrum, AP coccyx, lateral sacrum coccyx together in one film.
And the coccyx, like you're calling it an 8x10.
Yeah, because there's really no reason. I mean, your coccyx is literally like that big. There's no reason to have like an opening like this big. So you want to like make it smaller.
So if we go ahead and set that, like.
Yeah, that's why it's always been a habit of mine to preset my collimator. That way I know exactly like, so my first job I did film and we had 8x10 cassettes. So if you use like a 10x12 for a safe or like an AP coccyx, then you'd get in trouble because you wasted a ton of film because you're really collimating down to like nothing. So I always just like preset my stuff. You don't have to do that, but if whenever you go to do your AP coccyx, make sure you do collimate tighter. Because again, it's only like the size of a postage stamp.
So your patient has a lateral, can you do like that trick for the spot, like for the lumbar?
Yes, but you don't put an angle on the tube. That's the only difference. So
You can do that too.
absolutely,
Okay.
yeah.
It looks a little different weight-wise, but that's okay.
Yeah, so roll onto your side real quick. I'll show you. I don't know if everybody knows what she's talking about. I was taught the C shape too, and I don't have to really do it anymore. But so you find the top of the crest, put your hand at the top of the crest, and let your hand fall over. So for the C shape, what you're getting at for the lumbar spine is to find an L5S1. But because we're doing a sacrum, it's going to be lower. So you would,
Like usually we put it right here for the spot, and then you get it all like it's in the film, like I'll see the sacrum and the coccyx.
okay. So when I've done the C shape for the L5S1 like spot film, I always put my CR right at my,
Yeah, so they have us putting it right here.
yeah, that's probably why you get all the sacrum on there, because it's lower. But you could do that if you wanted. If that's more comfortable for you, you can do it whatever way you want.
Just visually I can see it because I've seen it on the,
Mhm.
once I've taken it.
Yeah.
I just didn't know if I would be correct for you.
Oh yeah, no, you're fine. As long as you're going to include all of, the only thing I'm going to come up to do or like to check whenever we go to do practicals is I'm going to make sure that this light is including all of the anatomy. So as long as you're collimated correctly, your the CRs are like guidelines. And they may ask you specifically on like your registry where your CR is supposed to be. But again, it's a guideline. Like whenever you start doing stuff as a tech, you can eyeball it. Like you don't have to be like, oh, well, I can find, because not everybody you're going to be able to find their crest or their ASI, patients get bigger or smaller, sometimes you're just like not comfortable touching somebody, that kind of thing. So you start eyeballing it eventually, or the longer you do it, you just kind of visualize where it's already at. So, but whatever is helpful to you. But yeah, so you could do that. But again, the way that's properly done is your L5S1 is like right here versus if they have you centering down here, it's to get the whole sacrum. Does that make sense? Okay. But. Yeah, the mass is on it.
What are you looking at for mass?
Yeah.
How are the boards gonna be as far as like, when you're last one
If you see those kind of questions, it's gonna probably be about questions, your inverse square laws and stuff. Because there's no like set mass for anybody. Everybody's different. I mean, even children, like everybody's body habits are different. So you always see text like I might walk up and say like, Cheryl, I'm gonna do like 90 at 1.5 on my chest x-ray, and somebody else might come behind me and do 90 at 1.2. It's
Then I just like KVP.
yeah, so that's what you're gonna get, because the KVPs really relatively stay the same, no matter where you're at, unless it's a pediatric or geriatric with, you know, unknown skin problems and stuff. So, yeah. I don't know how much their insurance changed. So, all right, we are done. Lab at home. And